A very good afternoon to all, and welcome to Lexplosion's continuing series of webinars. This is our first webinar of 2021, and at the outset, we wish you all a very happy new year. Thank you for sparing the time to join us, and we sincerely hope that this year mitigates all the risks that 2020 had to offer. My name is Nakud, and I, along with my colleagues Baishali, Namrata, and Abhishek, who are all fellow lawyers from Lexplosion, will be discussing the regulatory and practical aspects from the perspective of the private sector while the nation enters one of the biggest inoculation drives in our history. We also have the pleasure of being joined by an industry expert who happens to be one of our distinguished clients and will be sharing his perspective on the logistics involved in the entire vaccination process.
Speaking of mitigating risks, Nakul, inevitably warrants a conversation around the ongoing vaccination drive against the novel coronavirus. As we know that the Ministry of Health and Family Welfare has issued operational guidelines on COVID-19 vaccination drive, which has laid down various steps and processes to ensure a seamless vaccination, and has also prescribed a greater level of engagement of the private sector in the current phase of vaccination. It is certain that the private sector will be an important stakeholder in the vaccination, and therefore they will have to make several changes to adapt and comply with the regulatory requirements for the vaccine.
Headlines from last year were dominated by COVID-19, and we spent most of our waking hours trying to cope with the unique challenges presented by the pandemic for longer than we may like to remember. Our existing clients and everyone visiting Lexplosion's website have seen regular COVID-19 related regulatory updates during these times, and we hope those kept you apprised on the latest development in law from a pandemic-induced regulatory environment perspective.
Right, Abhishek. And as we all know, India joined the rest of the world and implemented a series of nationwide lockdowns starting in March last year. It was an overnight turn of situations which stalled our lives along with multiple businesses and professions across the country. Since the MHE unlock orders were implemented, we started moving towards a semblance of normality while struggling to adapt to a post-pandemic lifestyle of sorts, which might have seemed like a distant possibility roughly around the same time back in 2020.
Right, Baishali. Now, speaking of lifestyle changes induced by the pandemic, with India beginning its vaccination drive earlier this week, we are expecting a sense of normalcy to return gradually. However, that will depend on overcoming hurdles that can possibly hamper or disrupt certain aspects of making the vaccine available to the general public. And during these times, the pharma industry gained more spotlight than ever as people awaited updates on a possible relief from COVID-19. And as this industry emerged as one which might have been relatively less affected by the pandemic than the others.
However, the pharma sector, much like all other industries, were also facing their share of unforeseen challenges, ranging from the lockdown-induced disruptions in supply chain to issues in transporting raw materials and even medicine stocks. So the knock-on effects of the pandemic might have led to contractors and service providers invoking the force majeure clauses from time to time, or the mass disruptions in labor-dependent processes, and not to forget the constant risk of infection spreading amongst employees and workers. So all of these put together must have contributed to a difficult situation for businesses.
Agreed, Amrita. But I think in order to counter that, the pharmaceutical sector was subject to numerous regulatory measures to help tide over those hurdles. Some of those measures were fast tracking of regulatory approvals for development of vaccines, restricting the export of selected APIs, expediting the permission to manufacture sanitizers, and of course, in order to aid the domestic industry, prohibiting the export of sanitizers, ventilators, and other necessities like materials for masks and coveralls. Because on that note, this is an opportune moment for us to discuss how the vaccination drive might be implemented from production to delivery at such a large scale, while taking a look at some of the key regulatory aspects, which have helped us to reach where we are today, and hopefully will propel us towards resuming a pre-pandemic lifestyle.
Right, Nakul. And talking about regulatory aspects, during the year 2020, there were a plethora of notifications covering digitization of various approvals and permissions from different regulators, which included extensions or relaxations on timelines for various filings under, let's say, PF or ESI or under the Companies Act, amongst others. Now, a large chunk of these notifications comprised of MCA's involvement in allowing video conferencing during the board meetings. Then it covered timeline extensions for filing reports or returns. In light of this, I would further like to point out that in August 2020, MCA clarified that any spending for COVID-19 is an eligible CSR activity. Considering this step, even the CSR rules were amended to say that any company engaged in research and development of new vaccine, drugs, and medical devices in their normal course of business may undertake such activity for the next 3 financial years.
Yes, and however, this is also subject to certain conditions being fulfilled. Firstly, such activities need to be carried out in collaboration with any of the institutes or organizations. And these activities include contributions to incubators or research and development projects in the field of science, technology, engineering, medicine, all of which need to be funded by the central government or state government or public sector undertakings. And secondly, companies will also have to separately disclose the details of such activity in the annual report on CSR.
Also, Namrata, earlier this month, MCA further clarified that spending of CSR funds for carrying out awareness campaigns or programs or public outreach campaigns on COVID-19 vaccination program is also an eligible CSR activity under the Companies Act.
Moving on to the fact that the development of vaccine has been fast-tracked thanks to the rapid response regulatory framework, several companies are now involved in the development of the COVID vaccine. Some of the more notable ones are Covishield by Serum Institute of India and Covaxin by Bharat Biotech.
Abhishek, I think in continuation with that, I think it's imperative to mention that probably the most important aspect of a vaccine lies in its efficacy. The vaccine has been developed over the course of a single year, which is commendable, as opposed to so many other vaccines that have come before us have taken 8 to 10 years at least. This, of course, includes given the time for conducting research, clinical trials, and of course, the necessary medical approvals. It'll also be interesting to know that there are at present 9 COVID-19 vaccine candidates, which are in different phases of development in India.
In that context, I'd like to add that COVID-19 vaccine falls within the ambit of new drug under the clinical trial rules of 2019, and that the regime for development of vaccine across various phases of clinical trials have been prescribed under the Drugs and Cosmetics Act and the clinical trial rules. Now, compliance with these is imperative for any new vaccine to be launched into the market.
For instance, before conducting clinical trials, an ethics committee is required to be set up and registered by whoever intends to conduct those. And of course, a free informed written consent is required from each of those participants. Both the patient information sheet and the informed consent form needs to be approved by that same ethics committee before being furnished to the central licensing authority.
Right now, to add to your point, the new drugs and clinical trial rules govern clinical trials, beginning with the preclinical trials, where the vaccine is developed in the laboratory, followed by the clinical trials conducted in 3 phases.
Interestingly enough, the second schedule of the clinical trial rules provides for an accelerated approval process to a new drug for a disease or condition, taking into account its severity, rarity, prevalence, and lack of any alternative treatments. However, after granting accelerated approval for such drug, the post-marketing trials will be required to validate the anticipated clinical benefit.
Right, Namita. And talking about accelerated approval, so accelerated approval may also be granted to a vaccine if it is intended for the treatment of a serious or a life-threatening condition or disease of special relevance to the country and addresses the unmet medical needs. Now, further, if remarkable efficacy is shown in phase 2 of the human trials, phase 3 may be waived and confirmed later in the post-marketing studies. Now, in this context, an unmet medical need is a situation where treatment or diagnosis of the disease is not addressed adequately by available therapy, which I believe is what we have been going through the most of 2020.
These measures helped in taking steps towards fast tracking the vaccine, and multiple vaccines are under development now. So far, two vaccines have been approved in India. One is Oxford AstraZeneca's Covishield vaccine, manufactured by the Pune based Serum Institute, and two is Bharat Biotech's Covaxin, which are being administered under clinical trial mode. So, recipients need to sign an informed consent form before the vaccine is administered. And the vaccine will be first administered to high risk groups. So these include healthcare workers, frontline workers, people above 50 years of age, and those with comorbidities.
Thanks, Namrata. I think after we've spoken about how the vaccine is being developed and tried out, it brings us to the next point that manufacturers need to be cognizant of, which is the possibility of the occurrence of an adverse event. An adverse event, of course, is any untoward incident that takes place during treatment, in which a patient may or may not have a relationship with the treatment being given. An adverse event can also be termed as a serious one when an unfortunate occurrence results in death, disability, or hospitalization of that patient. These events can also include injuries to violation of protocols, adverse effect of the product under trial, and of course, scientific misconduct or negligence, amongst other situations. Given the unprecedented pace of the development of this vaccine, many countries agreed to provide immunity to the manufacturers against adverse events. The Indian government, however, till now has not followed suit and would hold the developers liable in case of any adverse event. In such a situation, we do feel that the importers of the vaccine might hesitate releasing the medicine in India.
Moving on to a pricing aspect, an area of potential concern for private sector is that the prices of COVID-19 vaccines have not yet been finalized. The Drugs Price Control Order regulates the pricing of scheduled formulations, including vaccines approved by the Universal Immunization Program of India. Now, price controls are a way of ensuring that essential medicines are made available at affordable rates for all. COVID vaccines, or being future vaccines, will also be deemed to be regulated by the Drugs Price Control Order, and if and when they are included in the Universal Immunization Program. Once the ceiling price is fixed by the National Pharmaceutical Pricing Authority, which is based on several technical factors, the manufacturer of vaccines must set the maximum retail price, which consists of ceiling price plus local taxes and duties.
Thanks, Abhishek. Sticking on the topic of pricing, we are yet to get any notification on what the COVID vaccine might be priced at. This could also seem as a potential roadblock for manufacturers to sell these vaccines in the market. It remains to see if price controls are put in place for the current COVID vaccine. Because in the past, we have seen that due to price curbs, advanced drugs have been withdrawn from India, citing prices being infeasible and, of course, business taking a hit.
Right, Nakul. And another related aspect which needs to be considered is the demand for spurt in the growth of associated equipment, which might be required during the inoculation process. So only manufacturing the vaccine isn't enough. In order to administer the vaccine twice over, given that there may be large-scale vaccinations every year, supply and availability of consumables such as syringes and hypodermic needles need to be ensured. As these will be covered under the gamut of medical devices, we would like to turn our attention to the government's notification, which stated that all medical equipment sold in India would come under the blanket definition of drugs and hence would be subject to price control under the Drugs Price Control Order 2013.
Now, Baishali, what this also means is that all manufacturers and importers of syringes and hypodermic needles, which will be required in volumes during vaccination, will need to adhere to market pricing, and manufacturers will not be allowed to increase their price by more than 10% in a period of, say, 12 months. Now, despite these stringent controls, we anticipate this is an opportunity for new entrants into the market. Now, it remains to be seen if the regulatory bodies provide relaxations to such price controls. And having said that, it is extremely important to be aware of the compliance requirements and obligations under India's price control laws while engaging in mass production of vaccines, syringes, and hypodermic needles, for instance. Now, inadvertent non-compliances may lead to unwanted consequences.
I would also like to add to the fact that at the backdrop of the COVID-19 pandemic, the Ministry of Chemicals and Fertilizers have issued a scheme for the promotion of medical device parks. Now, to have a sufficient supply of essential medical devices, a large-scale manufacturing it's a constant. It has to be there. So this scheme will help in creating a robust ecosystem for medical device manufacturing for the present as well as future vaccination drives in our country.
And after the vaccines have been approved, we need to discuss how it will be brought to the recipients. As we know, cold chains will be a big factor in such situations. Cold storage, which has been a bit of a limiting factor up until now, will have to be equipped to handle the vaccination drive. Their infrastructure needs to be ramped up, and supply chain managers will need to monitor and log real time factors such as temperature, moisture, to prevent any spoilage of the vaccination.
And in order to ensure a smooth distribution of vaccinations across the country, we again see the Director General of Civil Aviation has issued guidelines for the carriage of COVID-19 vaccine packed in dry ice by air for those responsible with the aim to educate them about the safety risks associated with the elements like dry ice. Now, dry ice is an important part of the cold chain distribution. And these guidelines include points like establishing quantities, safety measures, and ensuring ample risk assessments before loading the cargo onto the aircraft. Apart from the safety measures, the guidelines also focus on the packaging and the handling of shipments, and the fact that trained designated personnel are required to suitably handle these packages. This would also include important details such as package identification numbers, gross weight, and quantity of various elements.
Last month, the Central Board of Indirect Taxes and Customs notified the Courier Imports and Exports Amendment regulations, and this facilitates the import and export of COVID-related vaccines without limitation, along with durable containers for the vaccines, as long as suitable safety protocols have been followed.
That's true. So, to continue with that, complete end to end inventory visibility is vital to understand when vaccines will be available for use and to avoid any kind of damage or theft. Stocks can be identified according to the manufacturer and expiry date, which is extremely important given the relatively short life.
Now, from a logistics perspective, given that suitable vehicles with cold storage facilities will be required, private logistic companies are likely to fill that gap, probably with the option of one or more providers for national, regional, or local deliveries, which will ensure robust inventory management to optimize product flows from suppliers, supported by strict controls over temperature and handling of the product throughout the journey. Also, last mile delivery is one of the most critical parts of the COVID-19 vaccine supply chain.
Right. And longer distance journeys of bulk vaccine freight are typically made by larger trucks, with smaller trucks and carriers taking over for the last mile, performing multiple drops to healthcare centers, pharmacies, and hospitals. Accurate volume flow is very critical in that case. Even the larger distribution points can only accept 5 to 7 days of stock due to on site capacity limitations and cold chain requirements. Now, in light of the need to boost the logistics in the present scenario, a national conference was also conducted between the center and the state governments just 3 days back. The objective of the conference was to enhance certain areas of logistics chain across the states. These included simplification of transport approvals, warehouse development, and forming coordination committees at all levels. This step by the government is sure to tackle the logistics issues that were precedented for transport of the COVID-19 vaccine.
Thank you, Baishali, Abhishek, and Namrata. On that note, I think it's imperative that we bring about our industry expert who has been kind enough to join us to share insights on the logistics aspect of the vaccination. It gives us great pleasure to welcome Mr. Pradeep Kumar Dubey, the CEO of Winter Logistics Private Limited, which is the cold chain vertical of DP World. With over 25 years of experience across multiple sectors, Mr. Dubey founded Winter Logistics in 2017. In his current capacity, he is responsible for driving DP World's cold chain business growth and operation strategy. Good evening and welcome to our session, Mr. Dubey. Thank you for being with us. We really appreciate your time as well as continued support towards Lexplosion. With our discussion of the journey of the vaccination drive, it is imperative that we take the opinions of someone like you to give us a more intricate perspective. We had a few queries and I am sure that we could shed some light on it.
Yeah, thank you so much, Nakul, for your introduction and kind words. I'll be happy to answer to your queries.
All right, so then I'll take the lead on this. Of course, this is a phenomenon that we have not seen before and hopefully will never see again. But for such a special occasion, there's a special vaccine. And for a special vaccine, we need special treatment and handling, needless to say. There are cold chain requirements for the COVID vaccine, regardless of domestic manufacturing or imports. My question is, are we ready? Are we ready to store and transport the vaccine to the entire nation?
Yeah, it's a very good question. First of all, I'd like to mention that, it is encouraging and we are full of pride to see India at the forefront of developing vaccine, not only for ourselves, but also for the world. And yes, I'd like to mention that the private players like us are also investing in infrastructure to provide support for vaccine and distribution. And DP World has a network of 20,000 pallet positions today, spread across 9 locations. We also have refrigerated fleets, which is close to 100 plus, which is owned and outsourced. Now with that, I think we are capable of ensuring that we store, we do the primary distribution, the secondary distribution and tertiary distribution. So I feel that, as a country, we are very capable. And yes, DP World, we are capable of, ensuring that we have outsourced warehouses whenever it's required to ensure that, where we are not present, we can use those services to cater to the remotest corner in this country. And the same applies to the vehicle also. And also, I will like to mention one more point is that, the Pfizer came up with a vaccine at minus 78 degree or so. We have already worked a POC for that. And in a short time, we can roll it out. So that those trials we have done internally. So if you ask me, yes, as a country, we are very much capable to cater to everyone, ensuring that everyone gets a vaccine.
All right, thank you, Mr. Dubey. So the next question that I'd like to ask you would be in 2 parts. So with the limited availability of the vaccine in the initial stages, there are categorical steps that need to be taken, right, to ensure its safe storage and distribution, including factors like maintaining, certain temperatures and sealing the containers and vehicles. So are we equipped to handle such a mass distribution of the vaccine? And in the second part, what needs to be done to deal with the requirements of the different variants of the vaccine?
So, Namrata, you're very right. The temperature requirement variants for the vaccine is from +2 to +8. And for Pfizer vaccine, the variant is minus 70 degree. It's very, very critical that, the vaccine is stored, transported at right temperature. Also, it's very critical that one need to ensure that the shelf life is maintained. Now, in terms of the storage, I'd like to mention that all the warehouses have the data monitor, which ensures the temperature is maintained 24/7. Similarly, applies to the fleet also, where we have the GPS and the tracking and the data logger. Now, we also have a control tower, which ensures that, the temperature is maintained and the shelf life is maintained. So I think that takes care of this till the last mile we deliver. Now, yes, if you ask me, that tech-enabled platform is necessary to get the complete visibility and the real-time reporting of the temperature, which we have. As such, we have been catering to a lot of the global pharma customers.
Thanks, Mr. Dubey. But at the same time, on similar lines, a lot of apprehensions exist regarding the cold chain capacity in India. And on that note, I'd request you to share your thoughts on the status of cold chain and refrigerated transportation if we compare ourselves with economies like that of United States, for example. And also at the same time, I'd really want to know if there are any regulatory challenges that you anticipate while distributing from a logistics perspective at such a large scale, and if there's anything that the regulators, and if there's any help that you expect from the regulators on this.
So, Abhishek, it's a good question. Just to mention that if you have to compare India with US, in US, if I have to tell that the top three players, if you know the capacity of the top three players in US is 1.51 crore pallets. It's like, if you compare with India, the biggest player will be at 1 lakh plus pallet, and the state-of-art facilities will be 3.5 lakh pallet positions. But if you ask me in terms of with these sort of capacities, are we capable? Yes, we are very much capable. Reason being, the vaccine may not need those sort of volumes, capacities for storage. One. Second is we have the network in the country of mother warehouses, which can probably cater to the distribution. Beside this, you also have we have the fleet of refrigerated vehicle which can take care of the complete distribution. So I don't foresee this to be a big problem. Yes, we see a huge growth potential in development of cold chain logistics in India. The industry is growing at a 14% CAGR, and however, we will need to add on more capacities. Yes, it has to be state-of-art, fully automated. And DP World has the domain expertise, as we are committed to invest in the sector to develop it as an integral part of the supply chain. We have created an extensive network of logistics assets in India, be it express, 3PL, rail services, PFTs, port terminals, CFS, FTWZ, and feeder services. And what happens is through all the portfolio services available, we can cater to the end-to-end requirement of the customer. And along with the track and trace, that is what we can provide. Thanks.
So, which brings me to the next part of my question. Any regulatory challenges that you're anticipating on getting the vaccines delivered across the country?
So this is again a very interesting question. I don't foresee that there should be any issue like that. The reason being, the government has been very supportive, and it is a part of its essential services. The critical part is that people who are handling need to be aware of something that the temperature has to be maintained. The shelf life is very critical. Those things are very very important. Other than that, I think this is something which now everyone in the country is aware of. So I see there will be a smooth flow, to ensure that it reaches to the hospital and it can be used. So I don't foresee a challenge.
Okay, thank you. Thanks, that was really insightful. And a very related question. I just wanted to clarify is that innovation and evolution is happening almost daily. And do we have any developments in the cold chain storage and transportation line?
Yeah, that's a very interesting question. Yes, technology plays a very important role in the development of efficient cold chain network. Advanced technologies such as IoT and blockchain can bring transparency and provide key insight that can be used to reduce waste. Automation can help in building the special facilities dedicated to specific segment. So this is the area where, yes, we have been investing very heavily. Beside this, I'll also like to mention that, we have EU tactic vehicles which use the phase change material for the distribution. Also, there is a lot of innovation in terms of using solar energy where you have portable cold stores. As of now, these cold stores are very small but supportive for the chilled storage. So these innovations keep on happening. Yes, I will also like to mention that the blockchain plays a very critical role in this. For example, in the food industry, the blockchain can be used to track the product to the end consumer. Blockchain keeps a record of the food items from the order placed till the end it is consumed. So you know all the processes which are involved in this whole supply chain. And should there be an issue, you know, you are able to track the area of concern. So that is where it is.
Thank you, Mr. Dubey. That has been really informative. And talking about last mile delivery, like we were just discussing of the safety requirements and also the fact that you need to reach to the, the nook and crannies of the country to ensure a smooth transport of this vaccine amongst the state borders and even to the remote locations. So, do you foresee any potential challenge, or if there is any potential challenge, then what is the recourse that you are planning to take with respect to that?
So Baishali, just to mention that, you know, for the distribution of vaccine, you know, the right thing is to use the hub and spoke model. Uh, Also use of multi-mode. So basically, what can happen is that the vaccine can be moved because of the low shelf life from one city to another using air mode, and then from mother warehouses, it can be distributed to the point, maybe a healthcare center, uh, where it can be used by everyone. So I think I don't foresee that there should be any challenge because you're using a multi-mode as long as you keep a track of the shelf life and the temperature is maintained.
Thank you, sir. This, I think, would be our last query for the day. Finally, and very simply, at the end of the day, do we have ample cold chain storage spaces available across the country to ensure safe warehousing and storage? Because eventually, I think when you spoke about what was really important was about storage and handling. Do we have the wherewithals to store that?
Yeah, so just to mention, as I mentioned earlier, that DP World has a pan-India network of cold chain warehouses with the ability to have a temperature storage up to and a capacities of 20,000 pallet across 9 locations. And we have been catering to the biggest of the pharma customers. Yes, we've invested heavily in terms of the technology where we have invested on WMS and Oracle transport management system, which ensures that there is a track and trace. The data loggers are there to ensure the temperature is maintained. Beside this, yes, we have the express business where we can give the air support for the distribution. Uh, Again, the distribution hub can be used for packing, repacking, kitting. And all the facilities are FSSAI compliant. As I mentioned that our FR vehicles are GPS and data logger equipped, and we have a control tower which takes care of real-time information. We are also pleased that we are further investing in India's cold chain infrastructure as a part of our USD 3 billion commitment to the development of the logistics in this country. We are also aggregating supply of warehouses, refrigerated trucks, which will be delivered integrated for the vaccine logistics through our extensive digital solution. Thanks.
Thank you, and responses have been vital to us. And to finally conclude this informative session, I don't think we could have ended it in a better way. As we move towards the next phase of coming back to a sense of normalcy, safe to say that the private sector has played a vital role to keep us safe and to keep us going. The pandemic has indeed brought with it new challenges, but with the help of everyone involved, we were able to face it and can probably see that light at the end of the tunnel. From all of us at Lexplosion, thank you for joining us today. We hope you stay safe and you stay healthy. For any queries regarding the webinar, feel free to reach out to us and we'll revert to you as soon as we can. Thank you.